Quindi do la parola al collega Johan che continua nell'ambito della digitalizzazione del data integrity, questa volta applicata al test di sterilità, e con una presentazione relativa proprio alla digitalizzazione del test di sterilità con i challenge e i benefici nell'implementazione della digitalizzazione del test di sterilità.
Thank you, Davide. Buongiorno a tutti. I'm sorry, that's the only Italian I can speak. I'm French, so my presentation will be in English. I'm the Global Product Manager for Sterility. I'm based in Molsheim in France, and I will present you today about the challenges of sterility testing regarding data integrity and how we can overcome them with digitalization. So digitalization and sterility testing. First, digitalization is really at the crossroads of data integrity and test reliability. Why? Because digitalization is about converting any piece of information into digital format that can be easily processed by computers or electronic devices. And this usually allows better consistency, reliability, and ease of access of all the data. And so this really helps to achieve a better data integrity than paper records, for example. From a test reliability point of view, digitalization also allows communication, easy communication between electronic devices, between equipments, and also allows automation or semi-automation. And so allows to, for example, preset already settings in equipments or automatically gather information, collect information, deviation, and so on from equipments. So this reduces the human factor in a test, and so reduces also the risk of deviation and human errors. So this is really, digitalization really includes people, processes, and equipment. Sorry, that's the right side. Yeah. We are talking about documentation. We know that this is really important. This is the only way to show evidence, proof that we are following the validated processes, method, that we are doing a good quality. And we know that this is really under scrutiny. Over the last 25 years, there were 33,000 inspections from the FDA over the world. From these 33,000 inspections, it resulted 11,000 citations. And 40% of those citations are really related to documentation, to written procedure, to investigation, to traceability. Here, I give you some example of some of those citations that are related to sterility testing. The 11,000 are not related to sterility testing only, that's the full pharmaceutical process for sure, but some of them are related also to sterility testing. You can see here 3 examples where really the citations were addressing the lack of written procedure or lack of investigation because of the lack of traceability from the companies, and so the inability to investigate deviations or out of specification results. So what are the challenges with sterility testing? So sterility testing, the 3 main challenges that we can identify is that we need to ensure traceability, for sure. This is a regulatory requirement. And a sterility test will generate a lot of data that needs to be gathered, to be collected, reviewed, and finally approved. This is what we can call the data set. The workflow is complex. Sterility test is a very exact procedure that needs to be executed according to a validated method to really ensure a proper interpretation of the results. The workflow, yes, as I said, is quite complex, so there is really a need to prevent any deviations, any human error, and to track them. Maintaining data integrity. Sterility test, we all know it takes 14 days to get a result. It's a long time. Most of the data are generated at the beginning, at the execution of the sterility test, and we need to maintain the integrity of the data for 14 days. I started my career at the bench performing sterility tests at Merck 20 years ago. At that time, documentation was flying sheets in the labs that were stored in a binder. Anyone can access to it. The document can easily be lost, modified, or even falsified by anyone. So the maintaining the integrity of those data for 14 days is really also a challenge. When we talk about dataset for sterility testing, that's really a lot of information. It can be, here are just some example, the serial number or the calibration status of the equipment, the expiry date of the consumables that are used, the identification of the location, the date, the time, who performed the test, for example. They're also related to the SOPs, the traceability of the execution of all the steps of the sterility test, where they're properly executed, and so on, where there are deviations, error, or mistakes. And in the end, dataset is finished in a consolidated set of data that really include all the data generated during the test that will be ultimately reviewed and then included into, for example, a LIMS system. What is it really an issue for sterility testing is that as for any operations in microbial QC labs, people that are performing the test are not supposed to do anything else than just performing the test. So they're supposed to work aseptically, not touching any objects that could generate cross-contamination, pens, phones, keyboards, and so on. And so what we have seen internally, but also at a lot of customers, is that usually people that are performing the sterility test, especially in the isolators, are not following written SOPs, not really, and they are not recording what they do really in the real time. Usually that's in the end, there's a checklist and we check that yes, we did all the steps, but it's not really recorded in a timely manner. So there's really a challenge with what we expect from operators in a microbiological QC lab and what are the requirements from the regulations. So speaking of that, I did not understand everything to the previous presentation, but I think it was also presented. So basically the expectations, we can citate the ALCOA principle that is described in the European Union GMP, Chapter 1. And also the Code of Federal Regulation 21 from the FDA, so I will not go into much details. I guess you also know that topic. So the ALCOA principle, just to summarize, it provides information how to generate a good quality of data. So meaning we need to know if the data, is it attributable, is it legible and can be read by anyone? Is it recorded in a timely manner? So really at the time of the operation, so we should be able to tell, is it an original document or is it a copy? It needs to be in the right format of precision. It needs to be complete, consistent, enduring for lifetime, and also, of course, available for review, audit, or inspection. So the benefits of the digitalization in sterility test for the traceability, for example. Here you see an example of a typical workflow. You can see that several steps are performed. We have the workflow, or the preparation of the workflow, sorry. So at the beginning, we collect all the consumables that are needed to perform the test. For example, we're in the storage room. It's performed by someone on one day, and the day after, the test will be executed in the isolator by someone else in the isolator room. And in the end, after 14 days of incubation, the final readout will be performed by maybe even a third operator in the incubator room. So you can see that you can have really different people involved in different locations at different time, and really having digital devices. So here we can see, for example, that the guys have an electronic device, a mobile device. So being mobile really helps to ensure that everyone has access to the same documentation, record the documentation really at the time they do it, and also put all the data in the same system. So it really helps to have easy recording to reduce the risk of human errors, and it's really compliant with the recommendation from the ALCOA principle. Regarding the facilitation of the workflow with a digitalized system, you can have direct communication with the equipment. You can use barcodes. I think it was mentioned also in the presentation before. You can put barcodes on the consumables, on the instruments, on the incubators, on the isolator, everywhere. So you just have to scan them to really track all the data related to the traceability. And also you can provide a digitalized SOP to guide really the operator. So here, for example, we can see that the operator is guided step by step for all the steps of the sterility test. So the instruction can be displayed on the screen or via the headset that he has. And also he can do voice command for SOP via navigation to confirm that the operations were properly performed and so on. So that's really freeing the hand of the operator so he can really focus on what he's doing and make sure that he's following strictly the SOP. Regarding data integrity, having all the information collected together in a digital format at the same place in the digital system can really also help at the end to consolidate the full data set into one final report. Of course, in a system that is compliant with the 21 CFR Part 11 recommendation, that also respect the Alcoa Plus system. Okay. Yeah, we were close to lunchtime, that's why. And in the end, the system can generate really a full report where we can retrieve all the information, anything that is correlated with the test, a deviation log to have all the deviation listed, the list of consumables with the expiry date, all the check, and also a traceability of the execution of all the tests, also any information coming from the equipment that can be recorded. This kind of system can also be integrated with LIMS system and be really complementary to LIMS, LIMS software with a read or read-write possibilities. So it was really the theoretical part. You will see an example later how we can really put that into more details.
Grazie, thank you, Jan.